Blood pressure problems in pregnancy can be of three different types. The first type is where the mother has already got blood pressure issues before she becomes pregnant. So for these kind of women, they're generally already on treatment and they conceive while they're on treatment for the blood pressure medication. It is very important that these women see us before they conceive. So while they're still planning for a pregnancy, this is because we will need to adjust their medications into ones which are safe to take during pregnancy. We will also give them additional medications to reduce the risk of having complications like pre-eclampsia during pregnancy. These kind of women with pre-existing blood pressure issues are monitored quite closely during the pregnancy to make sure the blood pressure is under control with the new medications. And once it's under control, generally their pregnancies do not have too much risk. The second type are the women who develop blood pressure issues during pregnancy. If they develop only high blood pressure, it is called pregnancy-induced hypertension. Again, these kind of women are put on treatment to control the blood pressure, and once they reach a state where the blood pressure is under control with the medication and the baby's growth is fine, their pregnancies tend to again continue without too much risk. The third type are what we call as pre-eclamptics. Pre-eclampsia is a condition where the woman develops high blood pressure along with some other symptoms. The most common of these are losing protein in the urine more than what is allowed during pregnancy, having a small baby that we call as a growth restricted baby, or having symptoms like swelling of the hands, feet, face, what we call as edema, pain in the tummy, especially in the upper parts of the abdomen, headaches, any change in the vision, or where they become quite irritable with some neurological symptoms. So if they have any of these symptoms, then it is called as pre-eclampsia. This is one of the more dangerous conditions of the three. And in this condition, we very closely monitor the woman to make sure their kidney function is normal, their liver function is normal, to make sure the baby is growing well, and if the baby does have an element of growth restriction, to also make sure that the baby remains healthy. We try our best to maintain these women healthy with control of their blood pressure until full term, and then we would deliver, because the treatment for this condition is only through delivery. So if you have any issues with blood pressure, it is very important you see your doctor before you conceive and regularly during the pregnancy as well. These women are also monitored after delivery to make sure that they go back on the right treatment as required to make sure they don't get too low blood pressure after delivery.